This first suture we'll be performing is a simple interrupted suture. Now, first, with our needle driver on the right hand, and the forceps in the left, you'll evert the skin about 90 degrees to allow the needle to be perpendicular, penetrated into the skin. However, you'll supinate your wrist and allow the needle to come all the way through, leaving a little bit of thread left. And then you're gonna do the same thing. You're gonna evert the skin on the opposite side of the incision, come up and allow the forceps to grasp the end of the needle all the way through the skin. Now, once that is done, you'll drop your forceps, and with the needle driver, you'll wrap around about twice, and you'll grasp the end of the excess thread left. And then what you want to do is apply tension on both ends until a knot lies flat on the skin. However, you want it to be on either side of the incision and not right over the incision. And then, since this thread is a 2-0 size, we'll only be performing 2 knots. So as you can see, I just performed my first knot. Now this time, instead of doing 2 loops around the needle driver, we'll be performing only 1. Then once you're done, you'll want to cut, leaving a little bit left. This next suture is a horizontal mattress suture. Now, as the one before, we'll do the same thing, however, just a little bit farther away from the wound edge. We're going to penetrate the skin 90 degrees, just as the simple interrupted. However, this time, when we come out the other side of the wound, we'll want to reload our needle driver into a backhanded fashion with the needle pointing the opposite side. Now, either proximally or distally to the point where the needle exited, we'll come 1 centimeter away from the needle in the same fashion of everting the skin, penetrating through the skin and up, all the way through. And then the same thing on the opposite side of the incision. We'll evert the skin about 90 degrees, bring the needle perpendicular into the incision and all the way through. Now, as you can see, it made a little horizontal loop. Now, the same thing as before, we'll loop the thread twice around the needle driver and create a knot flat on the skin. We'll perform 1 more loop because it is a 2-0 needle, and just like that, we've created 2 knots. Same thing, we'll cut the last bit of the thread to allow for a clean suture. This next suture is the vertical mattress suture. Now, just as before, we'll grab our needle driver, we'll evert the skin with our forceps about 90 degrees and penetrate through the skin all the way through and up, leaving a little bit of excess thread left for our knots. We'll do the same thing. We'll evert the skin 90 degrees, penetrate the needle all the way through, about 1 centimeter wide out. Now, just like our horizontal, we're going to reload the needle in a backhanded fashion now this time. However, this time you'll want to come back on the same side of the incision, closer to the incision wound in a straight line. And same thing, we're going to evert the skin. We're going to come close to the wound edge, right aligned with the first needle incision. As before, we'll create 2 loops around our needle driver and create our knots. Now, this needle is a 3-0 size, so we will be performing 3 knots in this suture instead of just 2 as we have previously before. Now, once our loops are done, we'll grab our scissors, we'll cut the last bit of thread left, leaving small knots on the same side of the wound site. For stair strip application, you'll grab one edge of the stair strip, place it on one side of the incision wound, and firmly put it on the other side to apply tension over the wound. Now, same thing, you'll make sure it's evenly placed across the incision, placed on one side first and pulled over to the opposite side.